Welcome everybody to our webinar. This is I believe, our 36th webinar now over the last 2 years. And this is entitled Truth About Food Access in Our Country. And we have a very distinguished person with us. I'll introduce her shortly. But in the meantime, I want Pastor Jackson, I should say Reverend Pastor Jackson, teacher, educator, and so on and so forth. Pastor Jackson, please. Thank you.
Hey, good morning, everybody. Thank you so much for availing yourself this morning to this very, very important webinar. I'm excited to hear the discussion today. And so I want to encourage you to just give us your attention for the next hour or so. Be prepared with questions. You can mention them in the chat. And I'm going to pray and invoke and invite the Lord to be with us this morning. And then we're going to get started. So, right where you are, dear God, our Father, we love you so much. We give you glory and we give you honor. We're so incredibly thankful to you, oh God, for waking us up, empowering us, and then, oh God, allowing us to log on to be ministered to. You declared in your word that your people perish because of lack of knowledge. So I'm grateful for the knowledge and the wisdom that will be shared this morning. I pray now for each presenter. I pray now, God, for every listener. We pray that the receiver as well as the releaser of the information will speak with clarity and receive with coherence. Be with us and keep us now, I ask in Jesus' name, amen.
Amen. Amen. Amen. Okay, so move right along here. Let's see if I can get this thing to work properly here, Fred. Okay, I got to come up on my screen. Give me 1 second, guys. I see them, but I'm trying to see the main screen in front of me. Well, I'm going to share screen thing, but hang on a minute, guys. I want to be able to see this with that. Good. There we go. Okay, guys, sorry about that. So here we go. All right, so like I said before, today's talk today will be regarding the truth about food access, as well as, of course, security of our food as well. So today, there you go. I have to always show this because it's important for us. We're given a grant by Florida Department of Health, Office of Minority Health, Closing the Gap grant, right? So we've been partners with them now for going on 3 years. So that's going on now. We tend to give all kinds of different events. This morning, a number of our team is over at New Bethel Missionary Baptist Church, and that's in West Palm Beach, Florida. The address is interesting. It's a 911 address. I just noticed that 911 9th Street in West Palm Beach, Florida. They're there from 10 a.m. until 1:30 p.m. So part of our team is over there getting that done. Yes, this is me. I'll just move past me quickly before my pastor say that I'm egotistical and all this other stuff. But if you don't know me by now, I guess you won't know me. This person here, I got to tell you guys, she is incredible. Let me just read a few things here about her. Dr. Kyrie Jackson Cartwright is a nationally recognized nutrition thought leader, researcher, and expert transforming how America understands and advances nutrition security. As a former director, amen, of nutrition security at the United States Department of Agriculture, Food and Nutrition Services, she helped to lead the historic department-wide strategy to strengthen nutrition security and advance the goals of the White House. And that was under, I believe, the particular, I think it was Biden and Harris administration, but I think she also was part of the Obama thing as well. So once again, we are so, so, so delighted and proud to have her join Team CHP. And I told her that she's gonna be the voice of CHP in terms of nutrition, nutritional science. And so we're just so happy that she accepted that. I'm not sure if she knows what she's gotten into yet, but I guess she'll soon find out. It's gonna be a lot of fun, guys. Uh, and again, we cannot say enough about her. Um, she's done over 200 keynote addresses across the country as well as part of the world. She does podcasts, and she just does so many things. A national voice for childhood obesity. And Dr. Cartwright, I'm going to have you do a webinar on obesity, especially in children, and that I'm going to be adding to our agenda moving forward. So I'll talk to Dr. Gavin about doing that, but that's what we want to do. I think that'll be great for you to get involved in that part of things. She's a trusted national voice of childhood obesity prevention, food policy, and equity access to healthy foods. That's important, guys. Healthy access to healthy foods. And with that, we'll move on. I'll show my handsome face now. Oh, there you go. So next slide. Well, he needs no introduction at all. I'll go back to my friend, Dr. Gavin. Dr. Gavin, as my pastor said, he is definitely not just the GOAT of diabetes, but he's the GOAT of chronic disease. Dr. Gavin, as you probably all know by now, has written hundreds of articles, published a lot of publications, et cetera. And we're just so blessed to have him. He's board certified in internal medicine, chronic disease, and endocrinology. Dr. Gavin, as well as Dr. Cartwright, are so, so important to CHP's mission. And that is to bring the education of healthcare, especially in these two vital areas. Without food, the body starts the whole process by what you eat. And you are what you eat. So I'm just so happy that Dr. Gavin is hanging in there. He has a little situation going on now with extremity. I won't say anything further. If I do that, I'll be breaking HIPAA laws. So I didn't do that. Moving right along here. We have another person that joined us just recently too. Dr. Marissa Fenton. She has a doctorate, of course, in pharmacology. She is our director of pharmacy and medication specialist. Now, what Dr. Fenton does not know, she'll probably on most of our webinars because most of what we talk about is chronic disease. Guess what it involves? Medications. And Dr. Cartwright, she doesn't know it either, but I'm going to probably have to put her name in there a couple more times because again, it all starts with what we eat. So that's that with that. So I'm going to say, guys, early on, do not forget to fill out your post-test and your survey. This is critical for us to keep this process moving. And I say it all the time, and I'll say it again today. For some reason, God shows me favor. And when he shows you favor, the favor ain't fair. Now, it isn't fair. Favor ain't fair, right? And for the good Lord to bring me around all these good people, all these super leaders in all these different fields, didn't happen by accident or happenstance, right? So we want to take full advantage of this. We want to make sure that we go forth from here to make sure people know that they can join in at any time. They can also ask questions pretty much at any time, but we like to hold those questions as many as possible to the end. And I think it was said earlier, I think Pastor Jackson said that you can go into the chat. I won't be that visible after I do this, so I'll be in the chat, so I'll be able to answer the questions there in the chat as well. But again, guys, please make sure to fill out those post-tests and those surveys. We expect everybody to make an improvement, amen, from your pre-test to your post-test. That's what we call getting some good outcomes, all right? So go ahead, I'm all done. So Dr. Gavin, you can take over from here.
Okay, thank you very much, Dr. Reynolds, and thank you everybody for joining us today. This is really a very, very important opportunity for us to talk about one of the foundational aspects of our interest in and concerns about chronic disease and what we can do about it, about the various chronic diseases. So I can just start by saying what a joy it is to be on the same program with Doctors Cartwright and to have Dr. Fenton join us because they bring to the table so much special expertise that we will benefit from. But let me get right back to the substance.
Dr. Gavin, you did not mention Dr. Reynolds' name, but go ahead.
I think Dr. Reynolds has mentioned Dr. Reynolds quite enough. Anyway, but let me get to the substance of what it is we're about today. You know, there are many reasons why we spend so much time talking about food and nutrition when we're talking about health, wellness, and well-being and disease prevention. When you think about it, food is the very source of our physical strength and the source of our vigor. It is the source of the weapons that our bodies use to fight off infection. It's the source of the substance that our bodies use to keep our minds sharp and our hearts strong for the billions of heartbeats that we have to sustain over a lifetime. And it's what gives us the strength to pick up a child or a grandchild, or the stamina to do the electric slide or boots on the ground for 10 minutes straight. And it is an important social and cultural tool around which we gather to form community. Now, think about it. If you want to make sure that people show up for an event, whether it's a family event, a church event, a social or political event, what do? You feed them. It's as essential as the oxygen we breathe, if you think about it. So it's important for food to be available, and it should be available to everybody. And it must be safe to consume. These are the issues that we feel form the elements of nutrition security, which is really at the very heart of our focus today. Next slide. Am I driving?
No, I'm driving. Go ahead.
Okay. So our focus on food security in the setting of chronic disease has to acknowledge a few things, okay? There are challenges to making sure that everybody has access and that everything we consume is safe. There are two major issues. One is the inability to gain access to adequate amounts of nutritious food, and is it affordable, even when it's available? This is what we refer to sometimes as one of the social determinants of health, whether there is the ability to get reasonably nutritious food, and whether, even if it's there, is it affordable to us? And it has to be safe to consume. We should not have to be worried about the integrity of the safety of the food that we consume. Now, many of you have been to previous webinars that we've done, and you know that in matters related to chronic diseases and the management of these conditions, issues of nutrition are vitally important to us because of the central role played by food in virtually every aspect of the strategies we talk about for prevention of disease, or preventing the progression of disease, or for actually curing the diseases that we're dealing with. Food security is central. Next. When we talk about how important food is as medicine, okay, we don't have to look far. When we look at the FDA and we look at diabetes medicines, and you take out a patient package insert and look at the language of approval of medications, liraglutide, for example, one of the important GLP-1 drugs in diabetes. The language reads, this drug is approved as an adjunct to diet and exercise. In other words, it is to be used in addition to diet and exercise for glucose control and cardiovascular risk reduction. Now, why does that matter? It matters because all of the major actions of a drug like Victoza or liraglutide to reduce cardiovascular events, they are maximized when that drug is combined with dietary improvement, that is appropriate nutrition and physical activity. The same thing is true for the more popular one at the moment, tirzepatide, Mounjaro. The same kind of language is there. It is used along with diet and exercise to help improve blood sugar. Okay. And it matters for many of the same reasons. Next slide. Next. Now, if you look at a typical pyramid for disease management, and what this pyramid represents is that the foundation of management of virtually any of the chronic diseases about which we are concerned. And in this case, we're talking about chronic kidney disease in the setting of diabetes. But it would be the same kind of representation if we were talking about heart failure, if we were talking about cardiovascular disease, if we were talking about stroke. At the very foundation of this therapeutic or treatment pyramid, what do you see? That for everybody that's affected, all patients, they must have appropriate programs of exercise, must have appropriate programs of nutrition, and they must not do things like smoke. Okay, that's true across the board for any chronic disease, whether you're trying to control glucose, blood pressure, or lipids. And it's only after that, after you put that in place, that you start going to the specific medications and then to the more specialized medications at the tip of these pyramids. So the need for proper nutrition and exercise is common across all of the chronic diseases that we talk about. Next. So there was a recent study in the flagship journal of the American Heart Association. The journal is called Circulation. That's the name of this journal. And there was a study that was published in this recent journal. We're talking about as recent as July of this year, that showed that what's called MTG, medically tailored groceries, that is groceries that are appropriate for people with type 2 diabetes, the kinds of things that they should be eating. This was a study. They set up a delivery program of these kinds of medically tailored groceries to these families that were on Medicaid, okay? And then they gave them access to recipes and telemedicine counseling sessions to help them improve their glucose control. And what they found was that after 6 months, this is just with the availability of appropriate nutrition, there was a 0.4 point greater reduction in A1Cs compared to the usual approaches that they were taking to their care. And in addition to that, there were significant gains on the part of these people in their food and nutrition security. They felt better about their diets. They felt more secure about the nutrition that they had access to. So what does this do? These are findings that add to the growing evidence that addressing health through nutrition intervention can produce clinically meaningful improvements alongside standard diabetes care. We have to have that emphasis on nutrition. We're saying diabetes, but it's true for any of the chronic diseases that we talk about. Next. Now, the final thing that I would point out is that in addition to having access to nutritious food that speaks to the needs of people with various chronic diseases, the food that we take, that we consume, has to be safe. And recently we've had some concerns. You know that there have been public health advisories for salmonella in eggs, the parasite Cyclospora in iceberg lettuce, the bacterium E. coli in frozen blueberries, and the bacteria Listeria in soft cheeses. These have been concerns in our food supply. A particularly severe outbreak of Listeria in pasta meals made 28 people sick, 27 hospitalizations, 7 deaths in 19 different states. Okay, so we have to really be concerned about things like this, because when we see outbreaks that are associated with vegetables that normally would be considered quote, healthy, okay? Things that people like to eat raw. These are the kinds of things that undermine security. So food safety is in the news, and it is a central national concern. And next. And then there the concerns about packaged foods. Okay, same kinds of things that we've heard about: public health advisories, salmonella, cyclosporiasis in iceberg lettuce, E. coli, and what we is this in the next? I think it's the next slide. Okay, so there's some practical aspects of all of these kinds of considerations, and we are just so fortunate. I won't repeat much of what Dr. Reynolds has said about our special presenter and my colleague and partner, Dr. Kari Cartwright. Not only have we worked side by side in many ways in the nutrition arena and universe, where she is not just an expert, she is a champion. She is a champion with expertise in nutrition science, but more than that, established leadership in promoting that space where nutrition meets community. And she's been extraordinarily creative in the approaches that she's used. I think it's really important. I would simply highlight that she's an award winner. She's won the prestigious 2024 President's Council on Sports, Fitness, and Nutrition Hero Award. And the final thing I would say about her is that an organization that I was fortunate enough to help establish and was the first chairman of the board for, the Partnership for a Healthier America, that was formed as a result of Michelle Obama's Let's Move campaign. Kari has been working with that organization and is now a member of its board. And I'm really proud that she's taken up the gauntlet as I've become chairman emeritus of that board. She is, I know I have a champion that's in one of the driver's seats. So Kari, thank you for being here, and I turn it over to you.
Oh, thank you so much, Dr. Gavin, Dr. Reynolds. Thank you for everyone being here today. And I'm so excited to talk to you about my passion, which is nutrition. And so as we get started today, I just want you to know that Dr. Gavin has really helped us to understand why food matters clinically. It's so important. And I want to now bring this to everyday life. I want this conversation to be very useful to you. I'm not going to lecture on what we are doing wrong. I want us to think about ways that we can supplement what we already have. I want this to be framed in our assets, what we already have, because we're doing some things that work well, and we might just need a little bit more practice and a little bit more practicality to what we're doing. So by the time we finish, I want you to understand the difference between food security and nutrition security. But more importantly, I want you to leave with something you can actually use at home, in your church, in your community. And we're just very excited about the information that we're sharing. So next. Now, when we look at food as medicine, you just heard some very compelling evidence with the medically tailored groceries and food is medicine. But when we say food is medicine, we are not saying that food replaces medicine, Dr. Fenton. I want you to know that. So everybody, what we're saying is, to the point of Dr. Gavin, we're saying that nutrition is a very important part of prevention, treatment, and health. And so while the prescription may say take this medication and improve your diet, but that raises another question. Does the person actually have access to the food that we are recommending? Do they have the skills to prepare the food? Do they have the funds? Do they have the transportation? And so that's where nutrition security comes into the conversation. And I'm going to talk about that in a few slides. So next slide, please. So as we look at this, there's a reality. When we think about food insecurity, it's not some rare issue. Unfortunately, although we live in a very affluent country, it's not affecting a tiny group of people. These are families in this current economy who are working, raising children, taking care of aging parents, paying rent, buying medication, all of those things. And we're trying to make the food budget stretch. So one of the things I emphasize when I talk about disease prevention is that people bring their whole lives to the clinical base. And so as we think about that, they're going to bring work schedules just like we do. They're going to bring family responsibilities, food traditions, those things that we like to eat. Some people tell me they don't like to eat vegetables. We're going to bring our budgets. We're going to bring stress, transportation, all of those things. And sometimes we're just tired. And that's okay. So I want to talk about how do we make this practical? So when someone struggles to follow nutrition advice, we need to understand the life behind the choice. And I'm really, really keen about that when I'm working in partnership with community. So when we understand the why behind the behavior, we can offer support that actually fits the life behind the choice. And you can see this data here where we have a large percentage of our community members that are experiencing food insecurity, and some are even having low food insecurity. And I mean, it's just really something to be very concerned about. In my particular area of working with childhood obesity prevention, what gives me passion is knowing that we can solve the problem of hunger. And if any child goes to bed hungry, it's just a travesty, especially in our country. And so that's the work, that's the passion that I'm doing. And I just want to really reiterate that these are not people who are just, sitting around or doing anything. These are hardworking people who at this time can't always afford to put food on the table. And sometimes parents are going without eating just so their children can have meals. Okay, next. So this is a wonderful thing. I want to talk about the difference between food security and nutrition security. Now, Dr. Gavin laid out food security for you. As food security asks, do I have enough food? Nutrition security goes a little bit further. And that is, can I consistently get the food that is healthy, safe, and affordable that supports my well-being? And I think that's a wonderful thing. And I'm just so excited about this move toward nutrition security, because it's not just necessarily going to the pantry. And I've heard people say, oh, I got cans of corn, I got spaghetti sauce, but they didn't have the noodles, they didn't have the meat. And so when we think about nutrition security, have we really made an effort to make sure that people have equitable access? Imagine if we could achieve this, everybody. Equitable access to healthy, safe, and affordable food that is optimal for health and well-being. That's the definition. And so it's not that we are losing food security and the fight for that, but we want to make sure that others are well. Next. And again, Dr. Gavin brought this up, and I want to just really highlight this. This is the main recent outbreak that we've had in terms of food safety, because I just mentioned in that nutrition security definition that we want to have food that is safe. And so I do want to highlight this just early on, that this is a recent CDC report, and it looks at there were 1,600 confirmed domestic cyclospora cases. And I'm sure you've heard of cyclospora. So it was reported since May, and this outbreak has affected a lot of our produce. And so you see all the different symptoms on here. People were getting sick, having stomach problems. And my takeaway is really that healthy food also needs to be safe. And so as you look at this, I just put this little chart up here. This is something that we use in the community to think about 4 steps to food safety. And this is for any outbreak, any type of thing. Dr. Gavin gave you Listeria, E. coli, all the things that can affect our food. But particularly now, when we don't have as many people who are really monitoring food safety, we have to really work to be safe. So the first thing is that we clean. We're going to wash our hands and our surfaces and rinse off our fruits and vegetables. You're probably already doing that, but just noting that we do that. And then that we separate our raw meat, poultry, seafood, and eggs from our other foods. Sometimes when it gets packaged, it may rub against your produce, and you want to make sure that you're washing that off. And then we're cooking foods to the right temperature. If you don't have a food thermometer at home, especially when you are cooking your meats, make sure that you're at the right temperature when you are making your meat, so it can kill off bacteria, anything that is harmful. And then the last thing is to chill. So refrigerating our foods promptly. There are specific foods that have to be chilled at a certain temperature, normally 40 degrees. And that is so that bacteria doesn't grow. Foods like yogurt, a lot of types of things that that need to be chilled. And Dr. Gavin talked about our cookouts. So if you have your potato salad, make sure you put it on ice. All of those things, making sure that that when you have all of those foods components together, that we clean, separate, cook, and chill. And so as we think about this, we've had these outbreaks, and I just looked up the data today. We have had 2 deaths from this cyclospora outbreak. So just making sure that we are very cognizant about our food safety and making sure that these simple habits are reinforced, particularly when we are helping our family stretch food dollars and store leftovers. Okay, next. So I want to talk to you a little bit about my lens. Dr. Reynolds and Dr. Gavin mentioned that I was Director of Nutrition Security and Health Equity at USDA, which was a beautiful opportunity. I did that before returning to my post at University of Georgia as a professor in the Department of Nutritional Sciences. And one of the questions that stayed in the center of the work was, how do we move beyond simply feeding people to helping people to thrive with their food? And so that has been my passion for so long. And it's because feeding someone and nourishing someone are related, but they're not the same thing. We can feed in many ways. We can give SpaghettiOs and different things, but how do we nourish people and how do we nourish communities? So the lens that I bring to this is that I'm a registered dietitian, I'm a researcher and a mother and a daughter, and someone who has spent a lot of time working with families and communities. So healthy food must also be available. It must be affordable. It must be usable, and it must be culturally meaningful. We want foods that are important to our culture, and there are ways to prepare that in a healthy way. And my area is to start young, to get kids planting gardens, to get kids tasting fruits and vegetables so that they will be having this as a lifelong habit and also as a method of disease prevention. And again, it's never too late to start. I don't want you to think that, yes, I work with children, but across the lifespan, from the cradle to the grave, we can make changes that are important to maintain a healthy lifestyle. So the goal is not to lower the standard. The goal is to make the standard reachable. So as we are talking through this, I want to really talk about how do we support health in a manner that exemplifies dignity and equity in our food access and affordability. Okay, next slide. So this is not just about willpower. You see this data over here again. We have this high prevalence of food insecurity and very low food security. Okay, and so I've already reiterated how important that is. And so as a dietitian, I often give advice, but it also has this missing ingredient, and we act like people don't know what to do. And I think oftentimes people do know what to do, but the other things get in the way. So we say things like, eat more vegetables, cook at home, drink more water, exercise more. And then we send people on their way. And what happens? I think y'all know. Put it in the chat if you know what happens. But what if the issue is really not that they don't know what to do? What if I don't have transportation? What if the food that my clinician recommended costs more than what I can afford? What if when I get home at 7:30 at night, I'm too tired to cook a meal? What if I only have 1 pot or no working oven or 3 children asking what's for dinner and I know that meal isn't going to stretch? Those are the real issues that we are coming up in our communities, especially in our underserved communities. So before I tell someone what they should do, I'm working to understand what's getting in the way, because better questions equal better support. That's from the clinical point, but it's also helping community members to understand what their needs are and overcome barriers. There are many barriers to this. I'm a registered dietitian. I probably have every cooking gadget in the world, and I still get burnt out. I still got to feed my 3 children and my husband every single day, and I have to plan. And so a lot of things can get in the way. And so I want you to I offer you the opportunity in the chat, if that's open, to just tell me some of the things that are making it difficult for you to adopt healthy eating habits or healthy habits overall. And if I can see those in a moment, I'll repeat some of those back. But if you have some barriers, maybe we can chat about them in the Q&A. Just drop those in the chat for me. Okay, next slide. So I want you to look at this everyday nutrition security test. And it's a simple tool just to make the conversation easier. So we don't want to blame anybody. This is not about blame. We want to have good solutions. So I want you to ask yourself the questions. Can I get it? Is there a store? Is there transportation? Can there be delivery? Is there a pantry? And I will tell you, at my work at USDA, one of the things that we were working on avidly is to make sure that SNAP participants and WIC participants could have online delivery. We have partnered and worked together so that people can have their food delivered with dignity. And I tell you, it's something that I use. It makes it so much easier with pantries working to make sure that they're able to provide full meals, not just, corn, or not just, like I said, not just the spaghetti sauce, but the noodles and the ground beef or whatever you're doing to make spaghetti so that people can have everything they need. Now, when I say is there a store, I recently had a meeting with Dollar General, and they had experts from all over the state. And I did this at the federal level too, because I don't know if you know this, but there's a Dollar General within a mile of 75% of Americans. Okay, I think you see them. I think as you're driving along, I think everybody kind of knows that. You might not know that statistic, but you know that. And what they're doing is working to have more fresh markets and working to have more coolers so people can have access to frozen vegetables, to canned vegetables, and even to fresh vegetables. And so they're one of our largest suppliers now of groceries because they're working to do that better. So you might not have a formal grocery store in your community, but I want you to know there are organizations that are working to improve food security across the board. So when we think about that, the next question comes, and that's, can I afford it? And not just once. I mean, can I afford it repeatedly? And there are ways to stretch your budget, your food budget, and still have healthy meals on the table. I just heard a very creative way that there was a community in Georgia where they were working with teens to make recipes, and then they would have the local churches to buy the recipe list, and then they would put it together in a box, and the church would pack it up, and people could come to the pantry to make these entire meals, and then you get the recipe with it. And even though, I talk about nutrition security and the things, one of the examples that the kids came up with was to get some Jiffy Mix and some Vienna sausages and make some mini corn dogs, So sometimes you just got to stretch that food dollar. And I thought that was so creative. And so there are ways that we can do that. And I love partnering with the church because there are people that want to give items, but it's not just happenstance items. It's items so that families can make meals. The next question is, can I prepare it? Do I have the time? Do I have the energy? Do I have the equipment? Do I know how to store it? Do I have the skills? And I want you to know there are resources in the community that teach cooking classes. There are tons of free online resources. And even though SNAP Ed, which is a supplemental nutrition assistance program, education component, it has been ended currently, but there are still tons of resources. So I want you to know that. And the last question on here is, can I keep it going? And this is the one we often miss, because we get excited. We're going to go, we're going to do our exercise. We're going to, we do our resolutions, and we're going to cook every day. And we want to know, is this sustainable next week and next month? And so in my disease prevention work, I talk about getting on the bus and staying on the bus. We got to move this vehicle of nutrition security for our entire lifetime. And prevention is a journey. Okay. Health maintenance is a journey. Chronic disease management and treatment is a journey. So we can give someone a perfect plan, but if that plan is impossible to maintain, we put them on a bus they can't not stay on, and they ride toward prevention. And what do? They get off at the next stop because they can't really focus on it. So we got to make this practical. So a bumpy mile is still a mile in the right direction. So I want you to know this is consistency over perfection. This goal of maintaining your health is consistency over perfection. So I want you to think about how you might identify with these 4 questions and think about what comes up for you and your community or with your family. Next slide. So what comes up with food is medicine outside of a research study? I'm a researcher. Dr. Gavin does research as well. Food is medicine really does help us to treat disease. It can help prevent disease, and it can support people in making healthier choices. Many people don't necessarily, they know the basics. They know they should be eating more fruits and vegetables, but they might not know how to prepare the meat. They might not know how to stretch their budget. And so this can really support folks in making healthier choices, and it reduces risk through your everyday patterns. Small changes matter. I cannot reiterate that enough. So when support is the operative word, food is medicine works best when we can make the healthier choice the easier choice. And oftentimes when we have community, when we have people who are holding us accountable, people who can help us, when you're getting together and you're learning together, that's what makes it an easier choice. When you're able to plan, and I don't mean a perfect meal, but when you're able to get the things that you need for basics and keep the basics in your pantry, it's easier to come up with healthy meals. So next slide. So what can go in the grocery bag? Let's talk about that. I'm not calling this a perfect grocery bag. We are looking for health supporting foods, okay? Oftentimes people think that frozen foods might not be as healthy, but they are frozen at the peak of freshness. So I want you to know when you go to Aldi, you go to Lidl, some of those discount stores, and you're able to get frozen broccoli for 99 cents, that is fresh broccoli that has been frozen. When you're able to get corn and green beans, all of those things are very healthy, and I want you to know that. So fresh vegetables absolutely count, but so do frozen vegetables. We can also do lower sodium canned vegetables. We don't want to have high sodium. That's the issue sometimes with our canned foods. But we can get black beans with low sodium. We can rinse the black beans off. I always do that. Beans really count as protein. Eggs count as protein. So if you're stretching your food budget, remember that. Peanut butter counts. Oatmeal counts for our fiber. Most of us are doing really poorly on the number of fruits and vegetables we are eating, the fiber we are consuming, and the water we are consuming. Those are small changes we can make that make a big difference in terms of disease prevention. So one misconception I want to leave behind is that eating well requires everything to be fresh. People ask me about organic, or it has to be expensive, or it has to be Instagram worthy. Listen, when I see those meal prep people on Instagram, I have a fit because that's not how my kitchen looks when I meal prep. I am tired. I'm trying to manage kids. They're helping me. We're chopping. I'm teaching. And it's not easy work, but it helps us to get ahead for the week. And I've started really having conversations with my entire family. What are the types of things we're going to eat? What will be your role? Who can set the table? Who can chop? Who can wash vegetables? Because it's a family affair. I want you to know that it shouldn't be on one person. So, how many of you have some frozen vegetables in your freezer right now? Put that in the chat. If you got some frozen vegetables, tell me what you got. You got some broccoli, some string beans, some corn. What do you have in there? Because I want you to know you can get those in an affordable way. We have Publix. Florida has Publix, and I know they have BOGO because I just got some vegetables on BOGO this week. So I want to make sure that you're doing that. So I want you to be thinking about all of these things, getting your fruits and vegetables, increasing your protein, and increasing your fiber. We want some good nutrient-dense foods with complex carbohydrates so that we are doing everything that we can do for disease prevention. And I don't want you to forget flavor builders, herbs,
Did 17 minutes.
spices, onions, citrus, vinegar, all of these things, apple cider vinegar, all these things add flavor without adding a lot of sodium. And we have to do that. We have to think about that for disease prevention. And last but not least, drinking water first. We're going to limit those sugary beverages because they add a lot of calories, and we don't drink our calories. When we drink our calories, we're not as aware of when we're full. Next slide, please. Okay, so disease prevention friendly or diabetes friendly does not mean that it has to be expensive or unfamiliar. So sometimes we unintentionally give people the impression that being diagnosed with diabetes means abandoning everything that you grew up eating, and it doesn't. If someone loves rice and beans, my first question is not how do we get rid of the rice? It is how can we build something around what you already enjoy? Maybe a little less rice. Maybe we're going to do some brown rice, and we're going to pair that with more beans and more greens on the side and water instead of a sugary beverage, right? So we can still have things, but we have to do it in a way that is appropriate to manage our disease. And so in some of the work that I do with families, people are much more open to small beverage shifts than being told never drink a sugary beverage again. And these small shifts matter. So those beverages can be connected to convenience. It might be that they feel like they told me, hey, I drink this because I need caffeine. I got to get through the rest of the day for my job. But I want you to know that, you know, when you're working long days and all of those things, these small shifts matter. So as much as you can do that and carry your water bottle and balance out what you're eating throughout the day and the week, the more sense it makes and the more it affects and impacts your health choices long term. Next slide.
Dr. Conrad,
Yes,
I just
sir.
want to say that you're doing such an excellent job, and I'm amazed with how you're getting over the information in such a practical and such a meaningful way to our attendees. I'm looking at the chats. You got a lot of stuff in the chat, but I want the people to know in the chats that even though if Dr. Conrad cannot get back to your questions today, remember this is all recorded, and you can always go back and play it over. But excellent job, Doctor. I'm loving this.
Thank you. Thank you. And I'm gonna speed up. I'm
You
calling
don't speed up. Take your time.
everybody.
Now, Dr. Gavin, he can speed up, but take your time. You take your time.
Okay. Okay, everybody. So this is another takeaway. I want you to look at this as a budget smart plate formula. Okay. So start with the foods your family enjoys eating. Okay. Then build balance around them. So one thing is looking at the produce. I'm going back to fresh, frozen, canned. Protein, I want you to remember those beans, those eggs. I know we probably do a lot of chicken and fish. I don't necessarily consume a lot of pork because generally to be high in fat and salt, but there are lean cuts of pork, there are lean cuts of beef. So whatever you do, think about the things that your family enjoys. I use ground turkey for some of everything, but think about those things that they enjoy and build around it. Then I want you to have a high fiber carbohydrate. Oats, brown rice, corn, whole grain things. You can have whole grain pasta, but if you have disease management, you got to have the right portion. I personally do something called zucchini noodles. If we have spaghetti, we have zucchini noodles. We put that lovely sauce on top. If you can't just do that, do a very small part of whole grain pasta with that. And then I can have some garlic bread. Now I can't have pasta and garlic bread and the other thing, but I have it with vegetables. I have it with broccoli, and I just doubled my vegetable consumption. It's something I want you to try. You got to get this thing. It's called an instrument called the Spiralizer. It costs you $8. Make you some wonderful zucchini noodles. I love it. Also, the flavor boosters, everybody, we got to throw out those salt packets. Even if you're eating ramen, don't you dare eat that salt packet. It will break your heart. And I mean that literally, okay? So we don't want to use that, but we want to use seasoning blends. The Mrs. Dash, the seasonings have come a long way. I want you to know that. McCormick, some wonderful seasoning. I love doing different seasonings that don't have a lot of sodium. I want you to know that lemon pepper has sodium, y'all. I want you to look at the back of that, okay? I don't want you to think it has to be lemon pepper with no salt. I go to our farmer's market locally and I buy fresh spices that are not expensive because they're at the farmer's market. I want you to do that. I want you to season your food with onions and peppers and garlic because that is immunity building, okay? That's anti-inflammatory for the things going on in your body. I want you to use lemon juice and lime juice. And guess what? You can use hot sauce. It's not high in sodium, y'all. It's not. It's okay. You can use some hot sauce. All right. I just want you to know that these things are available to you. You got to add flavor without the salt. And I really, really, really do preach that. Make your plate healthy. If it looks like this, we had for 13 years, we had a what I call a federal symbol for healthy eating called My Plate. It has since changed with the new administration, but I really like it as a simple tool. So again, I'm just giving you these examples, and I want you to fill in what you would do. These are just examples. What would you do for your family? And if you're thinking about that, I want you to just really think of what applies. So for breakfast, could you have oatmeal plus a banana plus some peanut butter? And maybe if you have diabetes, you can't have the banana. Maybe you put in something else that's lower in carbohydrate. Can you have tortilla with, and there's now the carb balanced tortillas. Can you have that with eggs and spinach and salsa in the morning? I want you to get some veggies in the morning too. Because really the message is that as registered dietitians, we have 5 servings of fruits and vegetables a day. But we know for cancer prevention and chronic disease prevention, it should be 9. Put in that chat if you're getting 5 to 9 servings of fruits and vegetables, say me. I don't know. I know that many people are not. So I want you to make that a goal. Okay. Next slide. So I want to look at this 4 ways to stretch your food dollars. This is where I want to reduce the mental load because meal planning, I'm telling you, I got every gadget, everything, every skill, but meal planning is a mental load. So it doesn't mean planning 7 Instagram worthy meals. I want you to pick 2 or 3 for the week. Okay, start out there. Then check what's already in your house. Do you have some rice? Do you have some whole grain pasta? What do you have? What kind of meat do you have? Can you roast some chicken? Can you roast some vegetables? That means you don't have to stand over the oven. That's what I love doing that, so I don't have to stand. Do you have an air fryer? I don't know what utensils you have, but cook something. Cook once and eat twice. Okay, so I love doing pots of things. I'll do now look. I'm not telling you to do this, but I'll cook 2 meals at once. I have some chicken in the oven. I'm putting chili in the crock pot, and I got some wings for the next day in somewhere else. I'm using everything I can because I'm cooking now. I'm here now. I'm gonna season it up. Or sometimes you don't have a lot of time. Before I have a meeting, I might come down, season some chicken that I already have defrosted, put a little bit of my Worcestershire sauce and whatever I'm gonna do to flavor it, throw it in the crock pot on high for 2 hours, and I got dinner already ready. Because you got to have the protein. Y'all know you get the protein out the way, you can do the sides. You know what I mean? So you have to really, really think about how do you manage your time? Can you do something like that? And I do recommend, don't just leave your crock pot on all day. Let somebody monitor that for you. So think about that. And then I want you to think about one change you can make. Okay, we're not trying to add burden. I'm just trying to make the next trip to the store easier. I love to do soups. Some people think making chicken noodle soup from scratch is hard. It is not. It's one of the easiest things you can do. You can get you some low sodium chicken broth. You can get some chicken thighs. You can get some carrots, some celery, and some onions. And you can season it up with things that are not full of salt. And you can put a few egg noodles or whatever you want to put in there. And it is a wonderful meal. My kids take it for lunch. It is simple. And I'm telling you, there are simple ways to stretch out your dollars. So I want you to plan your meals. I want you to compare the store prices. I want you to go for BOGO. I plan my entire meal for the week on BOGO. Whatever's on BOGO on Wednesday, I'm planning, okay? Because I got to stretch my food budget. Also, I want you to think about, how can I use rice twice? How can I use this batch of ground turkey twice? If I get a big pack of ground turkey, there are 5 of us in our family. One night is tacos, the next night is chili. I want to cook all that meat at one time. No reason to do it too much, right? I get my big iron skillet out and I cook it all at once. And then when you get your bread, you can freeze it. You can get it and freeze it. If you get that on BOGO, because I had some bread this week on BOGO, too much, it'll mold. So you put it in the freezer. Also, again, I can't stop talking about my herbs, and you want to use your produce before it spoils. Okay. Now I talked about those zucchini noodles. You can spiralize them, put them in the freezer. You can chop up your tomatoes. You do have to use those. There are certain things, but we have to think about, how do we store our food so we can stretch it out, okay, for the week. I love to do salads for the week. You can make your salad stretch if you put it in a mason jar. And you just shake it up and you eat it. And I can go ahead on my meetings and all the things I have to do. Next. So you don't have to do this alone. And I have to put on my federal hat when I'm saying this. Programs like SNAP, the Supplemental Nutrition Assistance Program, and WIC, Women, Infants, and Children Program, are having public health impact. We get a return on investment. It lowers health cost expenditures, and it helps us to stretch our grocery budget. There is no shame in the game, okay? So yes, SNAP-Ed is gone, but their recipes, the shopping tips, are all still available. I will tell you specifically in Georgia, we have a program called Food Talk. I think I'm going to show that at the end. And our food pantries and our community markets are helping support families with dignity. And that's, again, making sure people can get entire meals. Now, in most states, we also have summer meals. We have a program called Sunbucks, but that's from state to state to help you stretch your dollar over the course of the year. You know, we have school meals. One of the things we're working on at USDA is universal free school meals. I think that policy would change the lives of so many people, of our children. And we want to have our produce incentive programs. That's when you can go somewhere and use your SNAP bucks and you get double the produce for the dollar that you're spending. So think about where you can use that if you have that. If you do not have it and you think you qualify, you can call your local SNAP office. You can go look at the USDA website so you can get help with that. And there are many community organizations that help people with those applications because they can be a little bit convoluted. Now, the new government, I would say, website for healthy food and eating is called eatrealfood.gov. You'll see the new information they have on there. It's not necessarily just a simple plate, but it's budget-friendly resources. So resource use is not a failure. It's a smart way to support the community, and I want you to know that. So next slide.
Dr. Cartwright, I have one of our community health workers. She has her hands up. Her name is Miss Cynthia Jackson. She has a question.
Sure, go right ahead, Cynthia.
Dr. Reynolds, I do apologize. I hit that by mistake.
Okay.
It's a great webinar. I'm loving it. Thank you so much.
Good.
Oh, wonderful. Wonderful. Okay. Well, I'll keep going. And I can't speak enough about how dignity matters. And I love this picture, this beautiful woman breastfeeding her baby. That's the most natural form of food in the world. And it's a beautiful thing. And the nutrition security approach asks us, whether or not people can access their food in a respectable and usable manner. And that's why I'm giving you all of these tips. And I mean, I have an abundance of them. This is truly my passion, and I hope it's coming through. But I want you to select food that is fitting for your life. Now, I'm not telling you that just because you like fried chicken and mac and cheese, you can have it every day. You can't have it every day. We can't have that every day. But we can have it one day, and we can have it with a salad. We can balance it out. And so it's not that your foods are bad. It's that we have to have the balance. So our cultural foods are valued. Whatever those things are you're eating have gotten us this far. And again, I'm going from an asset frame, but how do we make those small shifts? Again, if you're drinking, I've had people tell me, look, I drink 5 Cokes every day and that's what I'm gonna do. And you can't stop me. And then we start talking about it. And they say, well, I do want to make changes. I can go from drinking 5 to 1. And I'm gonna tell you, that's a major change that's going to impact their health. It really is. And so asking people for help, I know we are, as a culture, we are very private, but asking people for help is not it's not bad. Okay. I want you to know that. And I want you to know that there are resources that are clear and easy to understand. Dr. Gavin, I see your hand up. Go right ahead.
Thank you very much, Dr. Cartwright. Well, first I want to say, I want to say to this entire audience, and especially to Dr. Reynolds, I told you so. Okay, thank you very much.
Go ahead.
But
I knew it, just knew it. Go ahead.
You knew he was going to say that.
What I wanted to do is to have you just say a word about the smoothie trends. People are talking a lot about making smoothies and incorporating some of the principles that you've just outlined into smoothies. Do you have an opinion about that, and what direction would you give? And then secondly, I wanted to make sure while you're on a roll like this, is to maybe say a word or two about how is there a pathway by which we can make churches an outlet for some of the resources that are still available for people to use along the lines that you've been talking about?
Yes, so I'll talk about the smoothie first. Thank you for that question. I want you to know smoothies are good food, everybody, but I want you to go back to that healthy way of building a plate. If you're having a smoothie, it shouldn't be just apple juice and strawberries, because that's not going to give you everything you need for your health. It should have a protein. It should have maybe a yogurt base into it, or you can use something like hemp powder or peanut butter powder or milk or almond milk, whatever it is. Have a protein source. You want to have something green. If I'm going to do a smoothie for my girls, and my girls are 12, 10, and 8, and they would drink this smoothie, you got to put some spinach in it. You got to put something green in there so you can get some fiber, right? I'm going to put some chia seeds in there because that's going to give me what? My omega-3s, which are supportive for heart health and reduce inflammation. Okay. Then I'm going to think about my fruits. We talked about fruits and vegetables that we can put in. I love to do juicing as well. So I'm going to throw that in there too, Dr. Gavin. I love to do carrot, apple, beet juice. Again, beets are so nutritious. Now, I will admit, there's not many things that this dietitian won't eat. I don't like to eat regular beets because I think they taste kind of like dirt. But if you love beets, that's great. But I will juice them. Okay. Adding those fruits and vegetables into your smoothie is going to increase your fiber, your satiety. And then I want you to have a protein. I want you to have a fruit. So if you're going to be doing that, there are green smoothies. There's tons of different things. There's people that like peanut butter. There's people that can add cocoa powder. So you can have a peanut butter chocolate smoothie with milk. There's a lot of ways that you can make a healthy smoothie, but I want you to make sure that you have a protein source and some form of fruit or vegetable if you can mix it up in that manner. And there's a ton of different resources on that. So don't just kind of make a basic smoothie that's, I think this is going to taste tasty. I want you to think about even protein powder. How can I add in some protein, and how can I add in some fiber and some type of way increase my fruit and vegetable consumption if I'm doing that? Dr. Gavin also asked about how do we use churches as an outlet for nutrition information. And so one thing that we're working on at our church is making sure, well, first of all, we have a food pantry, but also making sure that we're able to get information out. So I'm going to just give you an example that I think could move toward the church. In my research at the University of Georgia, I've been on the board of the Food Bank of Northeast Georgia, serves hundreds of thousands of people in Northeast Georgia. One of the things that my students did, they would get different shipments of food in. I mean, produce, wonderful food. And they would write me on Monday and say, Dr. Cartwright, these are the things we got. What can you do? My students and I would come up with budget-friendly recipes, and we would come to the site where the food distribution was, do a cooking demo so they could taste it and see how to prepare it, and then send them home with a recipe and the fruits and vegetables that we got. One time we got kohlrabi. Put in the chat if you know what kohlrabi is, if you ever had it before, because most of us haven't, right? Kohlrabi is this kind of interesting looking vegetable, but when you shred it, it's like cabbage. So we showed them how to take a ramen noodle packet, throw that salt packet out. I told you that's not going to be good for your heart. Season it up with some herbs and spices, shredded it like cabbage, and they loved it. And they took it home and they were able to prepare the kohlrabi. That's the type of thing we can be doing at the church. We can do cooking demos. We can do tasting. We can share recipes. We have calendars. We have different websites that we can share. So we could possibly put together a resource, Dr. Gavin. I think that's a wonderful thing with different websites, and let it live so that churches can be thinking about ways to partner together. And you might have people right in your community that are willing to do cooking demos and different things, so that people can taste healthy dishes before they spend the money on it, because I know that food dollar is so important. Okay,
Glad
next
that you
slide.
mentioned that, because we are a faith-based organization, basically.
Mhm.
So we have a lot of pastors on. So we'll make sure that we get together after this discussion, maybe over the next week or so, along with Pastor Jackson, and go over how we can go about getting that done throughout these, must be well over 200-300 churches, right? So we have the access to it. It's just getting them that information would be so real. I mean, I'm loving this. And
Mhm.
Doctor, don't you ever tell me again. Oh, we ever talk about
Please
about
Well,
continue. Please continue, Dr. Cartwright.
well, listen, I will, and before you move forward, Dr. Reynolds, I did want to say these points on this slide that your choices matter. You should be able to make your food choices with dignity. Your culture matters because we have a long history of culture. And I always go back to, I always just am marveled that our foremothers would put okra seeds in their head. So when they got over here, that they could plant okra. Okay. They were thinking about nutrition as they were
wow,
being taken away and changed. So praise God for our foremothers and forefathers.
wow.
Also, your privacy does matter. I know sometimes we don't want to ask for help, but we don't want anybody going to bed hungry. And clarity matters. You got to know what these food choices are and how it impacts your health and your body, not just today, everybody, but long term. So that question may come up. How do you gain trust with the people that are giving the advice? I really work to build trust with the people that I'm working with. And a simple question can be, who is a part of your food decisions at home? I'm telling you, I'm making this a family affair, and it's going to teach my baby girl how to do this and not get burnt out over time. So that'll tell you more than any nutrition handout. How can we make this a family affair and make sure that we have support for healthy choices as a family, as a unit? It's not on one person, everybody. So next slide. Thank you, Dr.
It's a family affair.
It
It's a
is. Thank you.
family
That's the song.
affair.
I should have had that background music.
Right?
Please continue, Dr. Cartwright.
Okay, so what can our community partners do? Like our churches, like our clinics, our schools, our food pantries, everybody has a role, okay? A clinic can screen and refer, but they got to have somewhere to refer to. So a church might not run a diabetes clinic, but they can have a van. That's transportation to the store. They can have a kitchen. How many churches have commercial kitchens now? We got to feed the congregation. They can have volunteers, people that's distributing food. They can build relationships. There might be some unexpected partnerships with our churches that you don't know about right there in your backyard, where we can get out there and help prepare meals and have people taste things that are healthy. I know of an organization here called Gooder, and they do a lot of pop-ups for schools and different things, do wonderful work in the community, have opened up a grocery store in an area where there was no grocery store in the Sweet Auburn district. And I want you to think about, how can we partner? How can we make, I went to the library, took my kids to the library over the summer, and there was a summer meal site at the library, and the people were in there eating. And my heart just burst open because of my work at USDA. It's free. It's free to the community, but sometimes community members don't know. So how can we partner with our food pantry? Just like that example I gave you. How can the church put together baskets so that people can have a full meal? What does the pantry need? I tell you, I saw the president and CEO of the Atlanta Community Food Bank about 2 weeks ago. He said that the need has risen exponentially. Okay, the need is there. How can we help them? They can't serve all these people by themselves. And then how can we offer choices that are culturally relevant and familiar? Everything don't have to be foreign. Everything don't have to be kohlrabi. Okay, we can get some cabbage in there. Just simple things: apples, peanut butter, bananas, those types of things. So it's not, can my organization solve food insecurity, but how can we remove the barriers to it? Okay, how can we help people move forward? What are the barriers that we need to remove so people can have healthy meals with dignity? And so I want you to think about, as well, this is a collective. Write something in the chat. What could your church do? Think about that, okay? And then the next slide, Dr. Reynolds, your 3-step action plan this week. Okay. I'm going to bring us back to emphasizing disease prevention. And I'm going to say again that small wins matter. So prevention is not built in one perfect choice. It is built through small, repeated choices in real life. One meal, one resource, and one support at a time. I want you to look at this. Make one meal more balanced this week. I don't care what it is. Can you have your roasted chicken thigh with salad and broccoli, whatever it is that you like, with cabbage? What are we going to do? I want you to identify one nutrition resource. I'm going to give you one. I've given you several, but I'm going to give you another one. What's one you could use and share? And one support. What is one person, one clinic, one church member, one program we can promote and help move forward? Because sometimes people simply don't know what's out there in the community. Okay. And I want you to take 20 seconds in the chat, complete this sentence. Because this is what we do, behavioral interviews. Okay. This is motivation. This week, I will. And just put it in the chat. I want to know what you'll do. And I wish I could see you again so I could see what you were doing. This week, I will. What will you do? Tell me what you're going to do. Are you going to eat some more fruits and veggies? Are you going to put some fruits and veggies and some fiber in your smoothie? Are you going to work with your family and ask them what they want? Are you going to shop via BOGO? Are you going to get some more frozen vegetables that cost 99 cents at Aldi? People can't tell me that healthy eating is expensive because I know how to do it. I know how to do it on a budget. I got a family of 5, y'all. I'm telling you, it's not easy, but we can do it. It's doable. So I want you to put this action into what you're doing this week. And I told you we got to stay on the bus. Prevention is a journey. So now we're going out of the station. You're on the bus with me now. You can't get off. You got to stay on the bus. I'm sorry. You're on the bus with me now. So I want you to put that in the chat, and Dr. Reynolds will do the next slide. Key takeaways. If you remember nothing else, remember these 3 things. 1, nutrition security is about more than calories. It's all of these things. It's your health, it's your dignity, your culture. It's about safety and stability. We don't just want people to have calories, okay? I want 2, that food and medicine only works if people can actually use the food and the advice. We got to be able to use the food. I love it. I love the movement of food as medicine, but it has to be practical, and it has to be consistent, and it has to be easy to use. And 3, we get better outcomes when we remove barriers rather than blaming people for encountering them. There are so many reasons why people can become food insecure. Most of us are a paycheck away from becoming food insecure, okay? So just think about that. And I want to reiterate, those small changes matter. Even if at your church, there's one small step you can take, it's going to make a difference, because this is how we help communities remove the barriers around loving people and showing them support. Okay, so let's see. Let me see. Next slide, Dr. Reynolds. So after the key takeaways, I told you I would give you some resources. So the Dietary Guidelines for Americans is now very simple. It used to be a policy document that guided what we did in nutrition on a policy level. The administration has made it very simple for Americans to understand. It wasn't the purpose. It was for clinicians to translate it. But now we have it where there are practical tools and handouts. So you have to visit eatrealfood.gov. It used to be My Plate. We have Food Talk. That is a program that is in Georgia that we've made for low-income Georgians, and it's foodtalk.org. I should have put that on there. We have the SNAP-Ed Connection. I told you that there are recipes on there. The recipes still exist. We still have our Economic Research Service at USDA, and they really do look at the current food security statistics. And then locally, there's 211, where you can get community resources to think about nearby food pantries, benefits enrollment like SNAP and WIC, and social services. Go right ahead, Dr. Gavin.
Oh, I just wanted to, while you're on this slide, one of the key questions that I saw come through the chat was, are there any apps that can help a consumer to guide healthier food purchases? You know, and we might think about resources like this, lessons from, say, a study like that medically tailored groceries study that I pointed out. I thought this might be a very good point to address that question.
Yes, I don't. Well, I mean, you know, the world of, there's an app for that, right? There's a ton of apps. I don't necessarily use, well, I do. I actually use, for me, if I'm tracking my calories or food products, excuse me, I use Weight Watchers because I love the way that I can just scan things. Of course, I know that that is not a free service, but I'm trying to think of the, I'm going to think about it while we're doing the Q&A. Oh my gosh, it's at the top of my head, Dr. Gavin, but I can't remember the website. I'm gonna think about it, because it also helps you with tracking your food and with looking at label reading. If I have time, Dr. Reynolds, you said you're gonna have me back. I want to do a lesson on label reading. Everybody, we are mandated to have nutrition labels on our food, so you will know the amount of sodium, carbohydrate, fiber, protein, vitamins, and minerals that are in your food. And many people don't know how to use the label. And that's
and I can say, Dr. Cartwright, as a key partner with Dr. Reynolds, that we might consider this as part 1 of a multi-presentational format to talk about nutrition and the various components of nutrition. So as our audience can readily see, this is one of those areas where we will need to revisit it, and so we will be making plans for that.
Wonderful. And I did think of, it's called MyFitnessPal. And I know it says fitness, but you can track your exercise and your activities. It is free to the public. Many people use that. You can put in your weight and your height and all of that, and then you do your tracking. That's free to the public. So that answers that question. It just kind of went out of my head, but I think that will be very useful. So next slide. Thank you, Dr. Gavin. Next slide, Dr. Reynolds. So let's see. This is the resource that I told you about. No, go back one, Dr. Reynolds.
Yeah, give me a second. There
This
you
is
go.
a specific website for foodtalk.org. I thought I put it in here, but if you go on here and you see that little login at the beginning or sign up, you are going to have access to free online trainings and videos. Y'all, we put tons of research and tons of dollars into this. You'll learn online. You can do blogs. It's at your own pace, recipes, videos, resources. It's still alive. We don't have SNAP-Ed anymore, but it's still alive. I want you to look at it because we got to cut down on salt, fat, sugar in our diet. And again, that helps us to build a healthy plate. So I just want you to see that this is available to you. It don't matter if you live in Georgia or not. This is available to you. So I want you to check that out. Okay, next slide. I think that's just my references, and that Dr. Gavin had mentioned the circulation thing, and then there's a specific nutrition security article that I did with some colleagues. I'm almost done, Cameron. And then just this data that I got from the Economic Research Service at USDA, and just wanted you to see that, all of these things are based on various resources across the literature. And next slide, I think. Okay, that is me. So I'm just gonna say, I want this to land, y'all. Better questions equal better support. The goal is not to lower the standard. The goal is to make the standard reachable. And small shifts are not small when they are repeatable. So please stay on the bus to prevention, to health management, and we want you not to only survive, but to thrive. So thank you so much for having me. I hope I was able to share something that was meaningful and useful to you. This is my passion, and may you just be blessed with it to make changes for not even for just yourself, but for communities and for your children's children.
Dr. Fenton, she has been on very, very patiently and very calmly, it looks like. And if there's any questions regarding medications or anything like that, please be sure to ask Dr. Fenton now, or you can put it into the chat and we'll get those later. I want to just make a couple of announcements here. One, I'm very, very thankful to Dr. Gavin for introducing me to Dr. Cartwright. She is no doubt about it. She's been excellent. And yeah, I would be remiss not to have her a part of CHP moving forward, which she already is. She probably doesn't know that, but she really is already, actually. And we're doing a program called the DEEP. The DEEP program is for diabetics, people with diabetes, type 2 typically. And it's from the University of Illinois, Chicago. I'm sure Dr. Cartwright knows exactly what that is. The DEEP is an acronym. It stands for, the DEEP is Diabetes Empowerment and Education, a program. And Dr. Cartwright, she's going to be a very integral part of that DEEP program, because I want to make sure we have the best nutrition available to discuss with our patients. So if you have not signed up for one of our DEEP courses yet, this is like a serious 8 modules, about 6 to 7 weeks long program. But you need to sign up. So we have community health workers out there now getting people signed up. If you want to be a part of that, you can always put that in the chat as well. Just give me your name, your email address, and your phone number so we can get in contact with you to see if you will qualify to be a part of the DEEP program itself. We have 3 that's going to be done. I think 1 starts in September. Then we have 1 every quarter after that for 2 more quarters, all right? But again, Dr. Cartwright, I got to tell you, Dr. Gavin was not completely accurate about you. You are marvelous, okay? And I hope Pastor Jackson is still on, because we got another goat in the house. And you can smile for it, Dr. Gavin. You smile for it, doggone it. But we have a goat in the house. Yes, we will be doing several more of nutrition, because to me, looking at the whole process now in terms of health, everything starts with what you eat. And you break it down where the common person can understand it. I like getting on that bus. I'm on your bus.
Thank
and I
you.
want to be and stay on your bus. And I'm sure Dr. Gavin will make sure that we keep you on the bus, but you don't have to worry about it. You're right up in front of the bus, right next to Dr. Gavin, but closer to Dr. Reynolds than you are to Dr. Gavin. I'll move on. Anybody has questions?
I'm sure there are a lot of questions in the chat box, but I'm going to ask a very practical question, Dr. Cartwright, because it's one that my sons keep bombarding me with, and it speaks to the heart of nutritional recommendations. They're always asking me, how important is it to remove the skin off of chicken and things like that?
Good question. I like that question.
Well, you know what, the skin is just gonna give us more fat, right? And so it's not giving you any fibers. You know, when we put that skin on the breading on top of the skin, and we're gonna have some more calories in that way. So my preferred method is to do skinless roasted. Now I cook it up, Dr. Gavin. I make it taste delicious. Like my kids, if I'm gonna make some roasted chicken, they love it. But that's the easier way to do it. I'm not saying we don't ever have fried chicken, but we want to decrease the fat because what fat is the most nutrient dense calorie. Okay. So not only are we going to increase our fat content with the skin, we're also increasing our calorie content. So if you are on a type of diet, the diet you're consuming needs to reduce calories, that's what's going to help you do it. It's going to decrease that fat, it's going to decrease the calories. And so that's why we take that skin off, even though it's good and crunchy when it's fried. But I do air fry some chicken now, y'all. I take that skin off and I air fry it. And I know people tell me you can't fry no chicken in the oven, Kari, but I do it. So there are ways to make it tasty and healthy, and I just want people to know that you can do it.
Thank you. And Dr. Reynolds is misleading. I told him everything that you are and more. All right, go ahead. Next question.
Listen up. There are 66 questions that's in the chat.
Oh, wow.
Yeah. So I guess eventually we'll get to those. I guess either myself, certainly you, Dr. Cartwright, and I'm sure that my colleague, Dr. Gavin, would be happy to answer some of those questions too. But there's a ton of questions that's in the chat. And again, this has been an amazing webinar. Does anybody else have anything else to say, Dr. Gavin?
No, I just want to express similar appreciation to those of you who've taken the time to come out and participate, and know that we are deeply appreciative of everything that Dr. Cartwright has delivered today, but more than that, of the work that she has done across communities and the other venues in which she continues to work. And we're looking forward to the future opportunities that we have to engage with her and Dr. Fenton and other members of the CHP team to get this and related information across to you. And I love the concept that Dr. Cartwright has introduced here, that we want you on this bus. And we want this to be a beneficial experience, an enriching and healing and preventive experience for you on this bus. And we want you to stay on it with us. And not only that, recruit more passengers. So thank you all very much.
Okay, we're going to conclude. If that's it, I'm going to ask Dr. Parrott. I see he is on. He's on. He's one of our partners as well. Pastor Parrott, are you there?
Doc, I'm here if you can hear me.
Is this time? Okay, Pastor. Yeah. Can you lead us in prayer, please? Benediction.
Certainly. Let's pray. God, our Father, again, we're grateful for all that you continue to do in our lives. We thank you, God, for continued strength, continued purpose in life. And certainly we thank you for this opportunity, God, to hear more about how our health can be productive, and certainly how we can guard our health and protect our health by way of our eating. And God, we thank you for the mind that you provided to help us navigate our healthy way of life. Now lead us now, God, as we continue in life, that God, we will do those things only pleasing in your sight. Grant us grace for the time we have here, and you're careful as always to give your name praise, give your name glory. In Jesus' name, amen.
Amen.